Dr. Davidhizar, you talked to me a little bit a while ago about how one of your main purposes is to prevent illnesses, which of course makes a lot of sense. That's what doctors are supposed to be doing. But the fact is I have seen, prevention, number one, very difficult to get compliance with patients, and thus lots of doctors really are not as much into prevention as maybe they should be. Tell us how you go about it.
Well, every time I see a patient in my practice, if they're over the age of 50, we start talking to them about preventive medicine. Most diseases, unfortunately, happen as we get older. But we know that there's sort of three main diseases we've got to be on our toes for, and that's, of course, cardiovascular disease, heart attack, strokes, that sort of thing, cancer, and diabetes. Those are the three top killers in the United States these days. The cardiovascular disease being the first one, the second's cancer, and the third one's diabetes, and its complications. So I screen people routinely for those conditions. If we find those conditions early on, there's a lot we can do to prevent problems that would happen if we don't treat them early. Complications. If you get a diabetic treated early, we can prevent all kinds of problems with their vision, with their kidneys, with their circulation, and also with heart attacks. That's a common problem with diabetics because they have poor circulation. So there's many things we can do. And the other thing is just to ask the patient, what their family history is. Diseases tend to run in families. If there's a strong family history of cancer, then we've got to really look close for those likely places. If they have heart attacks and strokes, then we need to watch their cholesterol and other things that will contribute to that factor. So there's many ways we can do that, but usually involves some blood tests and some other screening tests to make sure everything's okay.
Okay. And then are there any advice you give your patients to, very specific advice you give them in order to prevent certain things, such as diabetes, such as cardiovascular? Frankly, I don't know about cancer because they just seem to be popping up. By the way, you say cancer is like on the number 2 in terms of, I think that's what you said, in terms of
yes.
Killer. Is there any particular cancer more prevalent than another one? Like, is it, the stomach cancer, is it the whatever people should pay attention to?
Well, it's changed over time. If a person smokes, it's a whole different category of cancers. Then it's lungs the most common. But if you don't smoke, women, the most common cancer now is breast cancer, and in men, the most common cancer now is prostate cancer. So we're always trying to make sure people are doing their screening tests for those cancers, and especially if they have a family history of it. If they have a strong family history, we start screening earlier than we do for normal people. So those sorts of things. But the thing that I try to get people to do to prevent problems is, of course, eat a healthy diet, get their weight down, exercise. If you do those things, a lot of diseases never happen to you. It's just that in the United States, we've all gotten sort of sedentary, so we're having lots of issues with health because of the poor exercise regimen we have and the poor eating habits we have.
Well, let's talk a little bit about the eating habits because, a good diet or a healthy diet, I'm not necessarily a healthy diet freak. I know most of what a healthy diet is supposed to be because of my wife, and I do read lots of books on it. The truth is, I love to eat mortadella sandwich and salami and all that stuff. Now, the fact is that there's lots of people who might think that that is a good diet, or like, for instance, buying foods in the grocery store which are pre-packed and pre-cooked and pre-everything, and you put them in the mic. Could you put a little bit of, because to some people donuts for breakfast and potato chip for lunch is a good diet. Can you shed some light on it?
Well, of course, as we become more industrialized in the United States and lots of other developed countries, our diets have changed tremendously, and that's part of the problem. You hit on one of the main points. In the processed foods you get, there's a lot of fat and chemicals put in there that are not good for you. The FDA, of course, limits the amount they put in there because too much would be worse
Deadly
for you than a small amount. But, we shouldn't have any of those things in our diet. So the more you stay away from processed meats and foods, the better. The other important thing is there's been a lot of publicity lately about about using plastic in microwaves or freezing food in plastic. There's a toxin that's released from the plastic when you do that causes cancer. And so the more people can be aware of that, the better to prevent that. You know, people used to always just take their water bottles and throw them in the freezer and freeze them, and then their water would thaw out and they drink it as it thaws out. Well, we don't want anybody to do that anymore because that causes toxins to be released into the water that you're going to drink. Same thing with microwaves and heating food up in plastic containers. That's also causes the toxins to go in the food. So we try to do those things. And then, you know, the diet that you should be on, of course, is lean meat, protein. You need to have protein. Fish is always better than pork and beef. Fish and poultry is good. Salmon is especially good because of the omega-3 fish oils that are present, which helps increase your good cholesterol. So there's lots of good choices you can make. But one of the things that, because most people in the United States, the most trouble is the carbohydrates. You know, we eat bread, pasta, rice, potatoes, and those, you know, are problems because they turn into sugar as soon as you eat them. So people who are diabetic have to really watch out for those things. But that's what makes most people gain weight and causes problems with their health. So if you can stay away from those, you can have some of them, but make healthier choices. If you're going to eat bread, don't eat white bread, eat whole grain bread. If you're going to have pasta, don't eat flour pasta, but eat spinach pasta. Same thing with rice. If you're going to eat rice, eat brown rice rather than white rice. And potatoes, sweet potatoes are better than white potatoes. Just make healthier choices, and of course limit the amount that you eat of those. Fruits and vegetables, the more of those you eat, the better. And lean meat, and that's a good diet if you can do that.
No pasta, no bread. What do you want me to do, die?
You can have a little. Okay. Not too much, though.
All right. No, I do get you. I definitely get it, and with no doubt, you know, me too. I definitely eat too much of it, and you know, my wife works hard on trying to get me off of some of it, simply because it's, you know, it's out there, it's good, but it's true, it is empty calories, you know. You actually get tired afterwards. So are you telling me that if a person, you know, like how we vacuum pack meat and then put it in a freezer, that's not good?
Yeah, it depends how you do it. But yeah, there's some issue with that. I think the liquids are more of a problem than the solid foods like meat and that sort of thing. We've been doing that for years, and I don't think the verdict is quite out on that yet. But liquids, especially, you have to be careful with freezing.
Okay. What do you think about you know, some people? I mean, this is a little bit off topic because it's more how should I say it? Compulsive. You know, people who like raw food, and by raw food I'm not only meaning vegetable and fruits and stuff like that, but like raw meat. You know, like we in Europe we eat steak tartare, which is basically hamburger meat, you know, kind of good hamburger meat, good steak chopped up and spiced up, and it's a delicatessen. And there are some books out there who say that eating that type of stuff, raw eggs, raw milk, simply is good. And I don't know, personally, I sometimes when I do that, I don't you know, go out and live all day on raw food, but as often I do feel that I get an energy boost. I do feel that if I eat a steak tartare, for instance, with a milk and a raw egg in it, I seem to be going, you know, more. Would you have any take on that?
Well, there's nothing wrong with doing that as long as you were sure that there's no parasites or anything in it that can cause you harm. And I know in Europe when they do that, they have a special people that inspect the meat, so it should be okay. So if you prefer it that way, there's nothing wrong with that. And sometimes actually the cooking process does destroy some of the good nutrients in it, some of the proteins and those sort of things, and any nutrients. So the more unprocessed or uncooked some foods are, the better, as long as we're making sure that we aren't introducing any kind of parasites into our body, would be the only issue.
Right. And you mentioned like salmon and stuff. Should we pay attention to that the salmon is wild caught, or doesn't it really matter? Does it really not all that much matter? If one way or the other way, it's better than eating potato chips, so let's just go for it type of thing?
Well, you know, the thing I'm concerned about with farm salmon is that they they feed them all this food that sometimes isn't the best thing for them. They have chemicals. They give them antibiotics to make them grow bigger, faster, and steroids, those sort of things in the farm fish, just like they do in some like beef industry. So that's a concern. The wild salmon is always the best, but it depends on where the salmon comes from. But my preference is always for wild salmon.
I'm sure it is, but the point is, you go out, you have lunch, and you see a salmon steak and whatever, with pasta probably. The waitress doesn't know, nobody knows, and chances are that it is farmed because due to prices and stuff. So obviously the wild one is better, but would you say that on an average, eating this type of, farmed salmon and normal beef is still better than going to the lean cuisine at Ralph's and pick up a pre-made thing and then microwave it?
Yeah, I would think it would still be better.
Okay. Well, absolutely wonderful. Well, again, interesting talking to you. We'll learn something again. Thank you very much. It's very. I never heard about that. Freezing water in a water bottle is not such a good thing. I never heard about that, so that's good information. Thank you very much.
You're welcome.